And welcome to section 9.8 on development and aging of our joints. Our joints start to develop from the 6th week of development, and if we have our fibrous joints developing, we'll see that mesenchymal tissue, which is pictured over here, will start to differentiate into dense, regular connective tissue. And for our cartilaginous joints, we'll see mesenchymal tissue start to differentiate into either fibrocartilage or hyaline cartilage. And for our synovial joints, we'll see that laterally placed mesenchyme is going to start to form an articular capsule, which you're seeing in these dotted lines over here, represented in C, D, and E, and will also form supporting ligaments. The next layer of mesenchyme will form the synovial membrane, which we see pockets of those cavities taking place here in D, and eventually all those cavities will come together to create one articular cavity that will be lined with the synovial membrane. And our centrally located mesenchyme may be reabsorbed or form menisci or articular discs, depending on what type of joint it is forming. Now for some pathology of our joints. Arthritis is really an umbrella term that is going to refer to rheumatic disease that involves damage to the articular cartilage. This is a group of inflammatory or degenerative diseases of our joints, and we can have symptoms such as joint swelling, pain, and stiffness take place. And if we want to keep our joints healthy, we need to be able to increase the flow of synovial fluid to the chondrocytes there and strengthen those muscles that help support and stabilize our joints. And in extreme, if we, let's say, exercise too much or maybe are a little aggressive in our movements, we may aggravate potential joint problems and may worsen osteoarthritis. So now let's talk about some of those more specific terms for arthritis. Gouty arthritis is typically seen in middle-aged or older males, and it's due to increased levels of uric acid that can build up within the joint. So here you could see that swollen inflammation that has taken place here between our first metatarsal and the proximal phalanx. In osteoarthritis, we'll see a degenerative joint in which we see mostly in older individuals due to a wear and tear of the articular cartilage in here. And we could see that fingers and knuckles, hips, knees, shoulders are the most effective, in which we see swelling in those jointed areas. Now, rheumatoid arthritis is seen in younger individuals to middle-aged adults and often more women than men. This is an autoimmune disorder in which we are going to see inflammation of the synovial membrane in there. And so here is a woman who has rheumatoid arthritis, and you can see how those joints have kind of shifted along with inflammation in the synovial joints there.